All right. Well, per usual, I want to try to start as close to on time as possible to respect all of you that are on. You will notice a change. I don't think we've done this on the webinar before, but we have added transcription to the bottom of the page as MASB continues to work in the inclusion space. We want to make sure that our members and others that participate with us are able to access our content and learn from us regardless of the format that we're using. And so this will become a regular occurrence that you will see as we do more virtual events. And I'll thank Stacy Bogard and the CPRM team for working through this. And as we're in the midst of also the beginning of a new website redesign, you'll see that website, it might be a year or so away, but you'll also see that being much more accessible for our members and those that use it. Thank you all for being on today. I know it's a sunny day and taking up your lunch to do this instead of going for a walk. It may not have been the first choice. And I think based on registrations, others also made the choice to go for a walk instead. But one of the things that we've been trying to do throughout the year through this is trying to bring information to you that will be helpful in your districts that is of concern, that matters to you as members of MASB. We've done this earlier in the year. We talked about the wellness of your employees. And I know as we're wrapping up the school year, it seems like timing wise, the question could be, why are we revisiting? But ultimately, you have a lot of employees that have volunteered to extend their school year into the summer school space. So for those employees, that break that they were hoping for over the summer and like all of us have needed isn't going to be there. And we also expect, even though people talk about going back to normal in the fall, I think it's going to become a new normal. It's never going to be the same. And so we thought it would be helpful to bring somebody in to have a discussion and allow you to ask questions about what that might mean for you as employers of school districts. And I'm thankful to have with us today, as we don't have the expertise in-house to do this, we were able to bring into the discussion Rhonda Jones, who is a health promotion consultant with Mesa Insurance. I know many of you have Mesa Insurance. And we will have Rhonda talk a little bit about some programs directly with Mesa, but we'll also talk generally. So for those that don't have that with their employees, we also should be able to come away with some ideas and how you can help out your employees, both in the current space and going forward. Just as we talk about it with your school kids, wellness, both physical and mental is important. And I think it will remain that way as we go forward. So Rhonda, thank you very much for being on with us today.
Thank you for having me, Don. It's great to be here.
Well, the first thing I want to talk about is your work at Mesa, and specifically in this wellness area. This is an area that you do a lot of work in, both in the physical and mental space, as I understand it. One program that you have that I'll have you talk a little bit about, and I'll ask you some questions about it, and then we'll then have a period of time where we have the members ask. But one of the tools you have beyond the larger wellness, the Mesa Wellness Program, you have one called My Stress Tools, which seems to be pretty appropriate and probably got a little more traffic this year than it has in previous years. Talk a little bit about that program and how school employees access it and what is offered through that.
Actually, and we just launched My Stress Tools this year. We, with the onset of the pandemic last year, I was busy looking for a platform, a space for our members, because even before COVID-19, in the public school arena, stress has always been a big deal. I go out and talk to schools about resilience and stress management, and I have been doing it for years, and that's always been the issue. My Stress Tools is a platform where our members can go and read different information on how to build resilience, how to manage stress, how to understand your brain chemistry, kind of the neuroscience behind stress management. It starts with doing what they call a stress profile. So you take some questions, you do a questionnaire, there's a battery of different questions that focus in on finances, it focuses in on your daily schedule, on different health and wellness areas of your life, and it comes up with a number for each individual that takes the test. So you carry this number with you throughout your interaction with the platform, and it's basically volitional. You go in and you can read articles, you can listen to podcasts of different industry leaders in wellness and neuroscience and stress management. You can, there's a book in there called Stop Stress This Minute. So we used to give that out hard copy. That book is on the platform, and every chapter covers a focus on how to manage stress or different relaxation techniques a person can do to help them kind of leverage their stress. You really can't get rid of stress, and we don't want to get rid of stress. We want to learn how to leverage it for our benefit and minimize the negative effects of stress that's out of control. So this is a platform that's available to all our MESA members. They can go in at any time, and it's not necessarily a prescription for depression or anxiety if that's a diagnosis. It is a way to minimize perhaps the onset of depression or the onset of anxiety, or say, for instance, if that is a diagnosis, it can be coupled with the therapy your doctor provides for those diagnoses. We know that stress leads to depression, stress leads to anxiety. So it's a proactive way to address it.
One of the things that we hear a lot in the kind of mental health space is mindfulness. And, a lot of times, even, our board members, we go to conferences and you're starting to see more and more speakers on the topic of mindfulness. I know that you've brought in speakers for MESA, for your members to hear. What do you kind of talk about what that mindfulness is as we think about the employees of school districts or just individuals like, everybody that's on the call?
Absolutely. To make it simple, I define mindfulness by defining where we are as a culture and a society. And most of us, even right now, if I catch you right now, you might be thinking about, what am I going to have for lunch? Or you might be thinking about the meeting you were just in, or perhaps the weather. I want to get out to my garden, or an occurrence that happened a week ago. We're basically distracted, and I call it mindless. We're operating in a mindless mode. We're not focused on the situation at hand, the present. So mindfulness is being aware of what is happening right in this moment. And I always use myself as an example. I'm a registered nurse. I've been a nurse for over 30 years. Over 30 years. I'm aging myself. But I used to work nights at this hospital here in my area. It's called Lansing General Hospital, if you're familiar with the Lansing area. 7 p.m., 7 a.m. I'd get off work at 7 a.m., drive home would be about a 20-minute drive, pull up in the driveway, and I'd sit there thinking, what route did I take home? I couldn't remember it, because the whole 20 minutes I was thinking about what happened at the hospital, what happened with that patient in 118B, what happened with the interaction with the doctor, that family, that medication. So I wasn't in the moment. So I was in the past. So with mindfulness, it's a practice that we all need to incorporate, because we built this lifestyle. And we used to be proud of saying we can multitask and we can do several things at one time. We used to wear a badge or sit in an interview and say, yeah, I can multitask. But now researchers are telling us multitasking is not good for our brain. It's not good for this prefrontal cortex, the executive function operating system of our brain. It kind of wears it down, and it is even considered a precursor to conditions like dementia or Alzheimer's. So just like we built a society where now we have to exercise, we sit all day, now we have to exercise because we eat a lot and we sit all day. Well, because we are operating in this multitasking brain status, we need to be intentional about practicing the present. or mindfulness, right? It's a modern day term for something that has been around for thousands of years. The monks, they used to call it meditation. We call it mindfulness. And it's basically, when I talk to people about it, especially in the school system, and you know what, I read, it was a white paper a university put out a couple years ago, and they did some surveys and studies on school employees and especially teachers. And after that study, it was specifically on stress. And the survey revealed that the stress that educators have in the public school system was equal to firefighters and nurses. And that's a lot of stress. I know that from experience. And one of the recommendations was mindfulness, teaching, educating, providing an opportunity for teachers, educators, school employees to learn about and practice mindfulness during the workday. And it's basically one of the most simple ways to practice mindfulness is engage in one of your senses. So that might be your sense of smell. Okay. Oftentimes when I'm feeling a little anxious, or I try to just do it as an intentional practice, I will focus in on a scent like lavender. And when you focus in on a scent, it brings you out of the future, which could be anxiety, that thought that's in the future. And it brings you out of the past, which can be something like regret or remorse. And it brings you in the present to, okay, I'm smelling lavender. And it's based on science. It lowers your cortisol. And you're familiar with that word cortisol. It's related, that's your stress hormone. So I said a lot to say. Mindfulness is about practicing, finding a way to practice the present. And you can do it through your senses, or just engaging or noticing your breath. A lot of us, we don't breathe like we should because we're always in this zone. And I want you to start noticing these things after this is over. I want you to check and say, am I really breathing, or are you just there, just shallow? Especially when you're in a serious project, you're really in a zone. You're not really breathing. You're not really inhaling and exhaling thoroughly. And that is the issue, folks. That puts us in this thing called chronic stress. I talk a lot, Don. You got to stop.
That's quite all right. They're used to me talking a lot, so they probably like somebody else's voice in that space. And I appreciate that explanation. And I'll have to use the recording on my 16-year-old daughter and see if I can convince her that multitasking is a bad idea. I've tried; it doesn't seem to work. You've created this My Stress tools this year for your members. What are you seeing as the engagement level? Because it seems like anyways, historically, that people are, particularly in the mental health space, even if we're not talking about like going to counseling or something or therapy, there's a stigma attached. And so it sometimes takes a while to get people to engage in the space, to really even admit that or recognize that there's stress or anxiety, or that they're having problems, or that they need some help. Are you finding the engagement that you were expecting in the new tools that you've put out there?
Well, that's a good question. And you said some real good things. The stigma around mental illness, often when you promote things or you market things and you say it is for mental illness, a lot of people are like, well, that's not for me. Pass, that's not me. I don't have an issue. So promoting it as a tool for stress is a little less stigma on it. And even with stress, going out, especially school employees talking about stress, some people are attracted to that. Yeah, that's me. I need to talk about that. But a lot of people are walking around saying, okay, I'm not stressed. I have it all together. And this was pre-pandemic. More people are, accepting, yeah, I need some help with this. I need to find some tools to help me manage this or alleviate some of the pressure I'm feeling. So stress is a more of a comfortable term to promote the product with. This is the issue though, especially, and I hope I'm not stereotyping school employees, but this is just about anybody that is busy. Often people that are stressed, chronically stressed, and right now that's probably about 98% of the Earth's population. But people that are chronically stressed usually don't do the things they need to do. They don't take the time to do the things you need to do. And it's a part of how our brain works. Our brain is, I'll use the term survival mode. So it goes for those things that are not probably the most intuitive thing to do. For example, when you're in chronic stress, you'll notice that you crave sugary things, salty things, and savory things, right? So think about that. What is that? That is Burger King, a combo meal. McDonald's, a combo meal. Denny's, a combo meal, something sugar. So, because the food industry has studied our brain, they funded the universities to study how do these humans operate under chronic stress, and we want sugary, sweet, savory things. We need cucumbers, we need an apple, we need some water, but those aren't the things we go for. So with stress, some of the things we need to do perhaps are rest, or we need to exercise, we need to eat right, we need to practice mindfulness, but our tendency is not to go for those things. So with the My Stress tools, what we do is we develop campaigns to try to draw people to the tool just to get there, take the stress profiler, do an activity. They may be absent for a moment. We do another campaign to bring them back to do an activity to learn more about how to manage this thing called stress. So it's a difficult task. It's a difficult task working with people that are already chronically stressed to help them manage the stress. But there's ways you can do it. You keep offering activities, providing incentives with those activities. You keep bringing, what is that old term? Bringing the horse to water. They'll take a sip, bring them back again. They'll take a sip. And it's not always the priority. You know, when you're stressed, the things that you should do are not always the priority in your mind. You know, when you're stressed, often you need to sleep, but for some reason you're up at 2 o'clock watching the news. You know, it's just you do things that are counterintuitive.
Some of the things that you just said about kind of what can be done for employees in the space, and I think about the audience here of school board members, possibly superintendents, is like from an employer standpoint, and we're in the school setting, what can schools do in the employer space here to try to, set up a wellness program that both, deals with the mental and physical well-being of their employees? That might be teachers, might be support staff, might be their superintendent.
Absolutely.
But what can a school do when we think about what does a wellness program look like that the employer could set up in a school?
Don, that is my expertise. I go out and I help school employees create worksite wellness programs. So if you're not familiar with that term, worksite wellness, that is creating a work culture that supports mental wellness and physical wellness. You provide activities to raise awareness about potential health risks. You create programs that educate people on how to lower their risk or how to manage a chronic condition, and perhaps even create community social activities where people are perhaps competing or working together, and it has some type of health theme where they are engaging in a health behavior during the workday. So often people that work, adults, we know what to do, we hear about what to do, but during the workday, we don't get the opportunity. So worksite wellness is a great opportunity to show your employees, your work culture, what you are willing and what you want to do to help them take care of themselves, to help them improve their mental wellness. First thing you want to do is identify a person, a liaison, or create a wellness team or committee. So that could be, the liaison could be one person, it could be you, or it could be somebody you know that is willing to take this on, be the trailblazer, or it could be a group of people. I've had committees built of a superintendent, a principal, perhaps somebody from each building if it's a large district. I've had committees that have represented different job roles. So you can do it in any way you want to do it, but it just takes one person or a couple people that are willing to carry it out. And it doesn't have to be people, I used to be a professional bodybuilder, and I have a history of being in fitness. So you think, okay, have Ron to be on the wellness committee. No, you don't want everybody. You don't want just the marathoners and the vegetarians, all the healthy eater. You want the couch potato that can do great graphics, or you want the person that may not engage in healthy behaviors, but they're always there and they're helpful to be on this wellness committee. And you decide within the wellness committee, what do you want to do as a district, as a group? What kind of activities do we want to do as a wellness team to help transform our district culture? Now, the first thing you can do, now you can be very methodical about this and do a survey. I put a survey out and find out what are your interests, ABC district, what are your interests, East Point Community Schools. We're starting a wellness program here, and we want to know what kind of things you want to do, and give them different questions to answer. Find out, do you want a fitness group during the workday? Do you want vending machines with more healthy choices? Do you want to do a marathon for breast cancer? Do you want to create a team, an East Point community team that walks and runs in a breast cancer campaign? Find out what people want to do, because this is key. You really want to help somebody, and you really want people to participate. So how do you meet that goal? You find out what they want to do. They're more likely to do something that they have told you they want to do. You know, I've been on committees where we know everything, and we just plan it out. We plan the time, the day, the platform, and nobody shows up. And we're like pointing at everybody. You're non-compliant, you're hard-headed. No, we didn't ask them what they wanted to do. It's that simple. Create something people really want to do. They know what they want to do. Create something that is within the time they can do it, so that could be included on your survey. Create something on a platform that they can participate in, that they're willing to engage in. So that might mean virtually if they're not ready to come out of the house, or that may be in the building. Okay, and this is key too. This is what I give my committees when I sit with them to help them create. And I just provide best practices in the wellness industry. And also I'm exposed to a lot of different wellness programs, so I can tell them what's worked and make it easy for you. Why recreate the wheel? But we all know that if we just, without doing a survey, most people are not getting enough physical activity. Without doing a survey, I could tell you most people don't eat right. They're not getting adequate nutrition. And without doing a survey, I can tell you most people are stressed. So if you go with those 3 keys, I call them the 3 keys of wellness, and you create activities based on those 3 keys, you have a program. So mindfulness is one of those keys. It addresses stress. So say, for instance, September, we're going to do a campaign on mindfulness. We're going to get everybody a book, a gratitude journal. I'm just throwing this out, okay? You pick this up if you want. This is a free one, Don. Gratitude journals for everyone that comes back in September, because nobody wants to really come back in September. So we want them to operate in gratitude, right? The science behind gratitude is that people that practice Thanksgiving, appreciation, they are more likely to engage in health promoting behaviors. They're more likely to go get their physical. They're more likely, when they have an option between a donut and a carrot, people that practice gratitude choose the carrot. I'm telling you, this is science. Look it up. Okay. So, but we want people, and it makes you feel better. Even children that practice gratitude, adolescents, they're more likely to stay within more positive emotional behaviors. And they're more likely to come from a rage status to a more positive emotional status when they learn gratitude. And adults have to practice that too nowadays, unfortunately. But I'm telling you this because I did this in one January when we came back from the winter break. I had gratitude journals sitting on everybody's desk. And I put out an email, and write this one down. This is something you can do too. I call it a Wellness Tip Wednesday. That's a simple campaign, because people want to hear just simple. They don't want to read a dissertation email about how they should be happy or how they should be healthy. Just give them a tip. I call it a Wellness Tip Wednesday. Every Wednesday they look for it. And the tip was about gratitude. I gave them a couple little bites of why gratitude is helpful scientifically. It's not just some, mythical thing. It's real science. It changes your brain chemistry. It promotes health. It promotes good feeling. It promotes positivity. It actually raises your serotonin and your dopamine. You've heard of those chemicals, neurochemicals. We take medication to help us, and they help us, what is the word I'm looking for? Enhance our body's own ability to release those chemicals. Well, when you practice gratitude, you're enhancing your body's ability to use those same chemicals. So this is a way, this is something you can do as superintendents, as school leaders, institute a committee. If you have a union, work with them. Each building rep or whatever roles you want to engage in that, it is definitely a gift to your employees. You're helping them. People that feel well, that have a higher sense of well-being are more productive. It enhances your immune system. You know, stress, the cortisol, the stress hormone, it compromises our immune system, and everybody's talking about immunity nowadays. Well, practicing gratitude, practicing mindfulness, all that enhances your immune system. So that's a mindfulness tip. You might want to do something within movement. Have a walking challenge. Engage Movement Monday. Now we're about to start this for the summer. Every morning at 7:45 a.m., I'm going to send out a Zoom link. And we're going to get on our Zoom platform and we're going to move for 10 minutes. I'm going to do something different every day, every Monday. I might do bicep curls and shoulder presses one Monday. One Monday we might stretch. One Monday we might just do some moves to some cardio, but it's to practice movement even on the workplace. And if anybody in the space exercises, you know how good you feel when you work out in the morning, how productive you are for the rest of the day. It energizes your day. It increases circulation in your brain. You're quicker. You're more creative when you're sitting at that meeting. Ideas just come just like that. So you can do that for your whole school district, and you can include the children. Imagine that, getting children to move first thing in the morning. It wouldn't be hard to do. And then the nutrition piece. That might be, I think I mentioned it, changing policies where they're not just donuts at the meeting or pizza. You might have yogurt and fruit. The vending machine is not just Nestle and Snickers, but you might have some healthy options. It's not mandating anything, but it's offering those type of things that those people who are healthy minded or reaching for healthier goals, they have the access to it. Now, this is key to that. It might be only maybe 20% of your work culture that's thinking this way, that's like, oh, this is great. But what happens, we know what is that called? The social theory. If there's just about 3 or 4 doing it, they'll affect those other 10. And by 2021, 2022, we'll have at least 10 people wanting apples instead of donuts, okay? You start changing the culture and changing the behavior.
Man, Rhonda, you made me tired.
I'm sorry.
Of course, Stacy's over there nodding. She's, definitely in the same space. She's liking it. And, it did make me feel good listening to you because not a wellness, but we have a culture committee at MASB, and
excellent.
Like the half an hour or the 11 to 11:30 or 11:30 to 12, we had our virtual yoga today. So we have put that together. We have a hashtag MASB Healthy where we also do the kind of healthy tips on a regular basis. And, from a school board member perspective to our listeners, just as it is for myself as the executive director here with our employees, it's relatively inexpensive. It's something really run by staff. It's not at any level. It doesn't have to be like, oh, as a board member, we're going to give this to the superintendent to do. It's, as you talked about, like, look for the volunteers. That is, I think, sound advice. It doesn't, it can be run internally, and it is something that I think as board members thinking about your districts, an idea to bring back, like low cost. It's really an employee benefit in a way. It makes your employees feel that, and it shows the employees that you care about their well-being as they go through their day and their weeks. And should be really something that is considered, particularly as we move back into, for some districts that didn't have in-person learning through a part of the year, it might be a good way to kick things off in the fall of the year, because clearly there will be a lot of stresses coming back into school next year. Even this year, we've seen a lot of safety measures in place as schools move away from some of those next year because they may not be necessary. You will have employees that are stressed because those barriers might be gone, or because masks aren't being worn any longer because they're not required. And so being able to put something in place as a school district, could help that anxiety for your staff, not just your teaching staff, but administrators and others. Stacey just posted in here, and it's really a question out to those that are listening to see if any of the districts that we have on today have put any wellness programs in place for your staff to try to encourage them, whether it be in the physical, mental health, nutrition space. Anybody out there that has done something that could unmute and maybe share with us? Not seeing anybody jumping out there. Maybe Rhonda will have inspired some of you to think about going down that road. I mentioned the upcoming school year, Rhonda, and the anxiety that will come with that. What are your thoughts? Based on what you are hearing from your members currently, what do you expect that districts will face just from an employee perspective going into the fall of the year?
Well, from what I've heard, I agree with what you're saying about the anxiety. There's a lot of people that have mentioned a level of concern and anxiety about being back in a building, working with kids. And, the way we've been going the last, 15 months, everything is so, what is the word? Unpredictable. We've been rolling even more than it's ever been. So we kind of tiptoe to the next day and kind of are there already as far as anxiety goes, trying to wonder, trying to determine how to handle tomorrow, but yet not knowing what tomorrow will bring. So anxiety is definitely one of the biggest things. A lot of school psychologists and wellness teams have been reaching out about different things they can do with the beginning of the school year in September, and they're planning for activities to help, to help engage the employees in something that can kind of divert their mind, help them to be more comfortable as we enter this new school year, our new way of doing things, whatever that will be. It's anxiety on all sides, parents, children, and educators. So I think as school employers, as administrators, I think it's important to be very sensitive to what people are going through, sensitive to the type of mental status people are carrying, because it's not just work, it's home too, and everything else that's going on in their lives. And it's a very sensitive time right now for everybody. So I think wellness, it would be a definite tool that if you have the person or a team that's willing to definitely move forward on it, even if you don't know what to do. It's a lot out on the web that you can Google ideas on what you can do in the workplace. And then the resources on the MESA website are free to the public. Lots of things you can do.
I think it is becoming good. You mentioned the assessment on the stress tools assessment. I think your wellness site also has an assessment, just an overall health assessment. And I know our employees here, many of them participate in a nearby clinic. And that's the first thing that clinic recommends doing, is a kind of a full health assessment, blood workup. The doctor wants to talk about kind of where you are at today and where we can move you to from a health perspective. And, the idea, it's both selfish from an employer standpoint in that healthier employees reduce your insurance costs. And it reduces downtime, it reduces employee absenteeism. But on the flip side of that, it's also very helpful to your employees that they are in a healthier space. And just the whole idea of that sort of, whether it be on the mental or physical health, that idea of assessment, that idea of making sure your employees are mindful of their own health in that space, and are getting annual physicals and being checked out, is, an area that it seems to be, growing again. I can remember, I won't say I'm not that old, but like when HMOs became more prevalent back in the, late 80s, early 90s, that was kind of the HMOs were selling that idea. And,
Right.
I think it seems like that's in some ways moved away from it, but now we're really seeing that kind of family practice getting back into the, hey, we want you to come in and we're going to really monitor you and help you out in that space. So I did see Grand Haven, and I said good job to Grand Haven. They do a wellness email, so they have taken a little bit of your advice and are sharing with their employees. And I would even say, and maybe you do this, John, a wellness email that's shared with your employees, but you can share it with your citizens within the community as well. And I think one of our board members, Susan said, I appreciate the MASB wellness emails. Like, we share that with our membership. It's not just a staff piece. And, we knew this year going through the pandemic that, our board members were experiencing stress at their board meetings and everything else. And so whatever we could do to help in that space was useful.
Absolutely. Yeah, and I agree with you. Often at the beginning of the school year or January, we'll do a annual physical campaign, just reminding people that their physical is a free benefit and encouraging them to at least just set the appointment. Because like you said, that is the beginning of your wellness journey. When you are engaging with your primary care physician, they can tell you what you need to do as far as those different health screenings you need and tests, and engaging in preventive care, because that is the best kind of health care, the health care you do to prevent illness so you can avoid sick care. And like you mentioned, that is less costly when you engage in preventive care.
Yeah, and I believe now with the Affordable Care Act, in most cases that annual physical is covered. And so your employees aren't looking at out-of-pocket expenses at that place. Any of their providers are going to put that, give that to them for free. And so money and finances should not be a roadblock to having employees be in that space. And I would say, we've been talking about it from an employee-employer standpoint, but when I think about it from a membership standpoint, school board members did experience a ton of stress this year, as did superintendents. And so everything that, Rhonda talked about today, think about it for yourselves as well. Like, taking care of yourself, mindfulness, taking the time out to think about where you are in that space is also of great benefit to each of you as individuals, and worth your time to think about. Now, I say that, I may not practice what I preach, but I at least can try to be a good advocate for you to take care of yourselves anyways. Let's see, East Point has had building level programs such as yoga. We also have discounts for gym memberships. That's also another space that I think is a great level. You see that. It's interesting to see it at a school district level. You hear about it in the, more for-profit sector where maybe a membership discount for a gym. That's nice to see in a public employment space to do the same thing. And often those can be of no cost to the employer because it's a partnership with that provider and they want more clients, and with a group, they're willing to provide a discount. Very
true. Places like Planet Fitness, they offer corporate discounts like that.
Questions for Rhonda? I know I've thrown them out there, or the opportunity in chat. Other comments that people want to make in this space about employee wellness, about your own wellness? I've really appreciated the insight that you gave us today, Rhonda. It's hopefully helpful for those that are on the webinar today.
And I reiterate what you said about anything I've said you can do at a group level or individual level, community level, your neighborhood, your family. Mindfulness, movement, nutrition, it fits everywhere, right? We all need it.
Well, I will also ask the membership, and this will be outside of Rhonda's space, but other concerns, issues that are cropping up in your districts that you wanted to bring up today and get some insight from some of your colleagues or from MASB staff, we'd be happy to try to address anything else that you have going on, if we're able to. Otherwise, this might be the first Member Matters webinar that we actually get done early. You'll get a free 15 minutes back to go for a walk and be mindful as you walk and take care of yourself.
Don,
Well,
I'll just mention that back years ago, I learned about self-care. I was going through a stressful time at work and literally it almost killed me. And I went through biofeedback. And for those of you who don't know what biofeedback is, they hook up electrodes to you, various places on your body, and it reads the electrical signals in your muscles in there. And on a scale of 1 to 10, with 10 being the worst, I was at about a 9.5. And after 6 months of training, learning how to control my stress levels, because I would hear the feedback, over the speakers. So when my muscles would get tense and stuff like that, I came out relaxing in 15 minutes, the equivalent of 8 hours sleep.
Wow.
And there, so that was almost 50 years ago. And I've used that same kind of methodology since then to help me through this past year and a half.
Well, thanks for sharing that, John. That's great. Any other last minute comments? Well, Rhonda, I would say thank you very much on behalf of MASB. Thanks for sharing what Mesa has for your members, but also for sharing other things that can more generally help any district in this space of health.
Thank you. Bye-bye.
All right, everybody, have a good afternoon and take care of yourselves.